Quadracel Dtap-Ipv Vial is a vaccine that combines protection against diphtheria, tetanus, pertussis, and polio. It's important to get vaccinated to protect yourself from these serious infections. The vaccine works by helping your body create its own antibodies for defense. However, it's important to note that vaccines may not provide full protection for everyone. It's important to follow the recommended dosage and timing for the best results. Your healthcare provider will advise you on the appropriate schedule for receiving this vaccine. Before receiving the Quadracel Dtap-Ipv Vial vaccine, make sure to read all the information provided by your healthcare professional. If you have any questions, don't hesitate to ask them. The vaccine is administered into a muscle by a healthcare professional, typically in the thigh or upper arm. To ensure the best protection, vaccines are usually given in a series of doses. It's important to closely follow the vaccination schedule provided by your healthcare professional and attend all scheduled medical appointments. You may find it helpful to mark a calendar as a reminder. There are different combinations of vaccines available, so it's important to discuss the risks and benefits of vaccination with your healthcare professional. When getting the Quadracel Dtap-Ipv Vial, you may experience pain, swelling, or redness at the injection site. Some people may also have mild fever, drowsiness, tiredness, headache, nausea, or loss of appetite. If any of these effects persist or worsen, it's important to inform your healthcare professional promptly. You can consult your healthcare professional about using acetaminophen to treat pain and fever caused by the vaccine. Rarely, some individuals may experience fainting, dizziness, changes in vision, or ringing in the ears after receiving the vaccine. If your child experiences any of these symptoms, it's important to inform your healthcare professional right away. Sitting or lying down may help, as these symptoms usually don't last long. It's essential to remember that this medication has been prescribed because your healthcare professional has determined that the benefits outweigh the risks of potential side effects. Many people who use this medication do not experience serious side effects. However, it's important to contact your healthcare professional immediately if you experience any serious side effects, such as high fever, numbness or tingling, muscle weakness, difficulty breathing, or seizures. Although it is rare, a very serious allergic reaction to this drug can occur. Seek medical help immediately if you notice any symptoms of a serious allergic reaction, including rash, itching or swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so if you notice any other effects not listed, it's important to contact your healthcare professional for guidance. If you are in the US, you can report side effects to the Vaccine Adverse Event Reporting System, VAERS, at 1-800-822-7967. In Canada, you can call the Vaccine Safety Section at Public Health Agency of Canada at 1-866-844-0018. Before getting the Quadracel Dtap-Ipv Vial, make sure to let your healthcare provider know if you have any allergies to vaccines, neomycin, polymyxin B, or latex. This vaccine may contain inactive ingredients that can cause allergic reactions. Also, inform your healthcare provider about your medical history, especially if you have a current fever or illness, immune system disorders, brain/nervous system disorders, or a history of Guillain-Barré syndrome. If you are pregnant, only use this vaccine if it is clearly needed and discuss the risks and benefits with your healthcare provider. It is uncertain if this vaccine passes into breast milk, so consult your healthcare provider before breastfeeding. When taking Quadracel Dtap-Ipv Vial, it's important to be aware of potential interactions with other medications. This vaccine may interact with drugs that weaken the immune system, such as cyclosporin, tacrolimus, cancer chemotherapy, and corticosteroids like prednisone. It's important to keep a list of all the products you use and share it with your healthcare professional to avoid any potential interactions. Always consult with your doctor before starting, stopping, or changing the dosage of any medicines. Quadracel Dtap-Ipv is a vaccine used to protect against diphtheria, tetanus, pertussis, and polio. It is given to children to help prevent these serious diseases. This vaccine works by helping the body build immunity to these diseases. This vaccine is usually given to children in a series of doses. The first dose is usually given at 2 months of age, with additional doses given at 4 months, 6 months, and 4 to 6 years of age. The best time to take this vaccine is as recommended by your healthcare provider. Remember to follow the dosing schedule provided by your healthcare provider for the best protection against these diseases. It's important to keep track of vaccine records for yourself and your children. This will help avoid unnecessary revaccinations in the future. Make sure to provide these records to your children and their healthcare providers when they are older. This will ensure that they receive the appropriate vaccinations based on their medical history. Make sure to keep track of when you or your child received the last vaccination, and ensure that each vaccination is administered as per the schedule. This is crucial for the effectiveness of the medication. Make sure to store Quadracel Dtap-Ipv Vial in the refrigerator, but do not freeze it. Keep all medications out of reach of children and pets. When it comes to getting rid of the product, do not flush it down the toilet or pour it into a drain unless you are told to do so. Make sure to properly dispose of this product and it is expired or no longer needed. You can consult your pharmacist or local waste disposal company for guidance on how to do this. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.